This video is about how smoking is related to Abruptio Placenta and Placenta Previa. So, to understand that, first we have to know what is antepartum hemorrhage. Antepartum hemorrhage. So, antepartum hemorrhage means any bleeding into or from the genital tract beyond the period of viability. So, what is the period of viability? That is 28 weeks. So, any bleeding that is into or from the genital tract beyond at more than or equal to 28 weeks of gestation is known as antepartum hemorrhage. Now, antepartum hemorrhage can be due to two main causes. First is Abruptio Placenta and second is Placenta Previa. There are other causes also, but these are the main causes. This is the most common one. Abruptio Placenta. Now, what is Abruptio Placenta? Not going into the detail, just giving an overview of this. What is Abruptio Placenta? It is just separation of the placenta. The separation of placenta from uterine wall. Just an overview. And placenta previa means when placenta is situated in lower uterine segment and it is covering the internal os completely, partially or completely. Okay, so this is placenta previa. Now, how the placenta previa and abruptio placenta, these are related to smoking. How smoking increases the risk of abruptio placenta and placenta previa. This is the question. So we all know that cigarette smoking, kind of smoking has nicotine. Nicotine has vasoconstrictive action that we are all aware of. Now, the vasoconstriction of uterine artery and umbilical artery plus the carboxy hemoglobin concentration, this causes hypoxic changes in the placenta, leading to microinfarctions at the periphery of placenta leading to necrotic foci. This necrotic foci causes separation of placenta. The separation of the necrotic foci causes separation of placenta, and this leads to abruption. Okay, so nicotine causes vasoconstriction of the uterine arteries and umbilical artery, plus it also causes increase in carboxyhemoglobin concentration. Now this leads to hypoxic changes, and that leads to necrotic foci, microinfarctions, necrotic foci, and abruption. Now, how this leads to placenta previa? So this hypoxic changes causes compensatory placental hypertrophy, and this increases the chances of placenta being situated in the lower uterine segment. Because the surface area of the placenta is increased, so this increases the chances of placenta to be situated in the lower uterine segment covering the internal os. So this leads to placenta previa. So now it's clear how smoking, now you don't have to cram that smoking is a risk factor for placenta previa and abruptio placenta. Now you can understand and learn. Thank you.